In Ontario's far north, the start of a new day and a cautious return to normal. This is New Gold's silver and gold mine in Rainy River. COVID-19 never made it in here, and the plan is to keep it that way.
It's not a matter of numbers, it's a matter of zero is the bar.
Renaud Adams is New Gold's CEO, now working from his home in Oakville.
That's the baseline. We are at zero and we want to stay there.
As an essential service, the mine didn't completely shut down when the pandemic hit, but it did scale back. Now, as lockdown restrictions ease and hundreds more staff start to return, the risk of infection goes up too. So New Gold is taking COVID screening to a whole new level and putting workplace safety to the ultimate test.
Put your back just a bit, perfect.
The company is the first in Canada to test employees for COVID on site.
And that's it.
With what could be an industry game changer. Because listen, here's the remarkable part.
So we should have your results in about 2 hours or so.
Good.
And we'll give you a call either way.
For me personally, I've always worked to see an outcome, to see something useful. So I'm driven by this, and I could see that we could really help people, organization, and make that difference, literally between life and death. So this is the device.
Mario Thomas is the CEO of Precision Biomonitoring in Guelph. He says as a scientist, he felt a moral obligation to create this.
As you see, there's no power cord. It runs on a battery.
A mobile rapid COVID test designed to flag positive cases and isolate them in as close to real time as it gets.
We call it a virus-free zone. So with the right protocols in place, people can be screened on a regular basis to ensure that even asymptomatic people who feel good and can go to work, they don't know they are infected. So with a proper screening program, we can catch this and ensure that the site remains virus-free. So
the test is essentially a miniature mobile lab that can analyze 9 samples at a time.
For this afternoon, we're going to be going through the steps.
On the other end of this call, the healthcare workers back in Rainy River.
That can be done simultaneously for all the samples you're going to do in your run.
Amanda Naum is the co-founder of Precision Biomonitoring. She's training them on what to do with the swabs they've collected,
including how to actually take your sample from a swab and then take that through adding to our reagents, doing the RNA extraction, running the whole process and getting it set up, and then also importantly looking at the interpretation of the results.
If that all sounds very sciencey, it is. But it comes down to a key component manufactured at this plant in Canada. Those tiny beads are reagents or biomedical ingredients. They're freeze-dried to keep them stable while they're transported to a place like a mine. And here's the innovative part. A single bead includes the COVID test and the reagents needed to diagnose a patient sample. It's designed to target multiple parts of the virus and why it's guaranteed to be 98% accurate. For any organization that wants to bring large groups of people back, the appeal is huge. From mines to automakers and schools, hundreds of calls are pouring in.
So is the thinking that most companies would use this daily, weekly? How often would they test people?
There's no fast answer to this. It depends on a number of factors, a number of people, the risk factors. The basic answer that the baseline today is 0 testing. So that's where we're starting from. So any testing in the workplace for the virus itself, not taking the temperature, but really testing for the virus, is an improvement over the current situation.
As for those first swabs collected in Rainy River, The results are back fast and they're all negative. And while this is just the start, the hope is that eventually every new crew gets tested at the beginning of a 14-day rotation.
So that's the priority number one, is your people. It's everything. If you don't have a healthy workforce or a healthy community, you can have the best mind in the world. It would never work, right? When you bring something new like this, you do it only for one reason, is what does that do? What does that move the needle? And because it's a lot of effort and a lot of time and an engagement of a lot of people to do this. So you have to have a reason, a common reason to do it.
It's too early to tell what difference the test will make here. There are already so many precautions, from regular disinfection of shared spaces like the cafeteria and keeping numbers low in sleeping quarters to allow for safe distancing. Some work is done in pairs, but this is an open pit mine and there are few close encounters.
So why take the step further then, if you could manage the risk?
Because it takes only one person. And that's really the risk here. And it would take one person to infect multiple others. And if we can do anything to catch that case on time and protect others, we'll do it.
And while the pandemic unfolds, a quick test can mean one surer thing in the move towards what's still an uncertain future. Joanna Brumiliotis, CBC News, Toronto.